Okay. Continue on with our program. We have our next presentation on cancer survivorship. Okay. So I'd like to invite both of our presenters, Vandana Sookdeo, Dr. Sookdeo will be joining us on stage. Oh, on Zoom. Okay, I'm sorry. I'm getting recorrected on Zoom. And Dr. Schaefer-Sully will be joining us here on stage. So what happens when a firefighter gets diagnosed with cancer? What happens at the moment of diagnosis when you hear the words, you have cancer? A program dedicated to understanding the phase of diagnosis and rehabilitation is what we call cancer survivorship. So I'd like to invite to the stage or online Dr. Sookdeo and to begin our presentation on cancer survivorship.
Hi, everyone. We're going to switch it up a little bit. I'm going to go first. Little Zoom issues. All right, so I am really, really excited to present to you today about the FCI Cancer Survivorship Program. So this has really been a labor of love that we've been putting together for the last 2 years. So when we started FCI in 2015, we really focused on exposure assessment, cancer prevention, and it wasn't until a few years ago that we said, you know, we really need to focus on survivorship. And so what we did was we worked with Dr. Frank Pinedo, who you'll hear from, Vandana, who worked with Dr. Pinedo, on some of the interventions he was doing on prostate cancer and cancer survivorship, and we've tailored that specifically to our firefighters. So we're going to go a little bit into it. Our first slide. So as we know, and the reason we're here, firefighters have a unique occupational exposure and risk to different cancers. And so in America, we know that the current survival rate for all cancers combined is 70% among whites and 64% among Black Americans. The number of cancer survivors are increasing due to better screening and outcomes in oncology. But cancer survivorship in the fire service has been understudied. We don't really know how many people are surviving. And the other thing is we don't know what resources are out there for firefighters. A lot of firefighters had come to us saying once they got diagnosed, they weren't really sure where to go besides Firefighter Cancer Support Network, which is one of the main organizations. But so we were looking to see what else we could do for our firefighters, specifically here in the state of Florida. So our first formative work, and on the slide you can see, oh, I have the clicker. No wonder why I'm losing my mind. Sorry. I'm wondering why it's not moving. So here you can see we've put together a 3-phase process for our program. So the first phase is the qualitative formative work. So what we did was we did focus groups and interviews to really understand what were some of the challenges, what were some of the experiences of firefighters who were cancer survivors, and what were things that they were looking for. Phase 1B is the analysis. So that's where we find our qualitative themes that come out, and that is really what's informing our intervention. So like all of our studies, we use a community-based participatory research approach. So really taking the words and the needs of the firefighters, our community, to build what our intervention would be. Phase 2 is the actual intervention, which I'll get into, but it's really not the full intervention yet. So what we wanted to do is really test the feasibility and usability and get feedback from our firefighters. So again, anything we do, we always want the feedback of the firefighters to see, is it something that's gonna work? And then the last phase, which we are working towards, is the actual intervention. So we'll go into step-by-step and see what those results were. So as I mentioned, we did some formative work. So we did some focus groups. We did 4 focus groups and a few interviews with a total of 29 firefighter cancer survivors. The interview guide was semi-structured, and so the main structures that we looked at was areas related to work, health and cancer diagnoses, challenges and outlook, the effect of cancer on their career, as well as the ideal workplace for cancer and return to work. So again, with cancer survivorship, it's been studied, very extensively, but firefighters are very unique. Your occupation is very unique. So not only returning to work, you're returning to a job that's very strenuous after a cancer treatment, but also returning to a job that you know is putting yourself at risk for cancer. So there's a lot of things that not only physically, but mentally, firefighters need to deal with when returning to work. So from our 29 participants, you can see 10% were female, 90% were male. The average age was 53. We had about 14 different types of cancers of diagnosis of the group that we interviewed, and 19% of those participants had been diagnosed with more than one cancer at the time. And so some of our work that came out, the main themes, or the domains of concern, as we call them, for these firefighters, were managing their health and well-being. So not only physical health, but also the mental health, and then also changing their outlook on life. So a lot of what we were talking about this morning as far as modifiable risk behaviors, a lot of them talked about how their whole outlook on what they were eating, what they were doing for physical activity, but also their outlook on what they were doing at the station. They were really second-guessing on things that they did in the past and how they were putting themselves at risk for cancer. The other thing was, an issue of concern was navigating existing support. So a lot of them said, once I got my diagnosis, I really relied on my family. They were, my foundation, there's the ones who helped me get through it. A lot of them also talked about peer support, so their colleagues at the fire service. So not only receiving support from them, but also there were struggles with how they were to bring up the fact that they had cancer. Some people didn't want their crew to know. Some people went, they got diagnosed, they had to have surgery, they came back, they took a leave, and they didn't tell anybody. So these were all things that came up that were, concerns for them, as well as organizational, how to navigate through their department and their organization. Who do I talk to? Do I talk to my union? Do I talk to my captain? How do I know what my benefits are? So these were all questions that they had. So, the main point of us doing this focus group was to get these type of answers. What were resources that they wish they had once they had their diagnosis, and how can we provide those resources for them? And that was the last theme of requested resources. So one was looking for a centralized cancer education. Two was firefighter survivor support groups. And then 3 was universal cancer training. And so I put here a few key quotations that aligned with some of these themes. One was, regarding support. Having somebody is probably one of the most important things when somebody gets cancer. And the last one, related to resources, is I tried to do online looking. I know a lot of you guys had really good success. It pointed me to doom and gloom because you're researching and then going down a rabbit hole. So that was a big concern that people said. We Google things, and then I'm Googling, I'm down this rabbit hole, and I don't really know what is the right information I'm getting. So I would have loved a place that I know I'm getting good information and that it's reliable. And so, again, we took that information, and that's how we created our survivorship program intervention. So what we've done is we've created an online portal, and I'll go into the intervention briefly, but it took us a good while to create this because we tailored it specifically to firefighters. So it's partnered with a cognitive behavioral stress management program that has been done with other cancer survivors, but utilizing some of the main concerns that firefighters had. So one, cancer information. In there, we're able to break down several cancers, and what we did was we picked the cancers that are highest in the state of Florida for them to go through. Obviously, we're not going to be able to cover all the cancers, but we were able to cover a good amount. What to do at diagnosis, understanding stress management. That was another thing that came up was, I used to be able to, whenever I was stressed, I would go out for a run. Because of my treatment, I'm really weak and I'm tired, I can't go out for a run. What are other ways I can do to manage my stress? Linking thoughts and emotions, effective communication and managing emotions, partnering with my health system, lifestyle changes, financial planning during treatment, and then return to work. So these are things that we really tailored to our firefighters based on their concerns. And so if we were pretending that we were scrolling through this, I can take you through just a few sections. So if I were to click on one, you can see this is what one of the portals looks like, or one of the chapters. So it's a 10-week intervention, so each chapter is a week. So here, if you were to click on this, you can read through each of the different bullet points or topics, and then you can see on the side, for every week, there's exercises and activities for the firefighter to do. And so, again, this intervention, it's an online intervention that's a group setting with a live interventionist. So they're going through it with them, but then they can also do it on their own. So if I were to click on one of the exercises, it would take me here, And then you're able to go through this worksheet and ask yourself some questions, and it enables you to maybe think of things that you wouldn't have thought of. So like, for example, this one is communicating with your treatment plan. And one of the first questions is, write down one question you want to ask when you communicate with your doctor. That's something that's really important, especially anyone who's had a cancer diagnosis or a family member. You have so many things going through your mind, and once you sit in the doctor's office, you can't remember what your question was. So it's a really good way for them to reflect and have that worksheet with them. The other thing that we've added is kind of a little achievement and rewards for them to go through each week to make sure that, they're going through the activities and they're thinking about it. So they get, if they do 30 minutes of the activity, plus also one of the actions that is listed completed. And then here's just the last one that I wanted to show that was specific to our firefighters and how it was tailored. And so once we've created, we took the information from our focus groups, we created this online portal. Then we tested it with our phase 2. So utilizing the cognitive behavioral stress management intervention, it was a 10-week intervention. So we used it with two groups of 5. We had a live interventionist who would meet on a weekly basis and go through each chapter with them. In addition to that, we also collected an intake survey to begin with, and then our main outcome that we're measuring is health-related quality of life, as well as symptom burden. So they also complete a few other surveys, and then, specifically with this phase, we wanted to get their feedback. So today I'm going to present to you their feedback and what we've done as far as taking that feedback and how we are revising the program for the next phase. Oh, and I'm sorry, and the last thing, we also did blood collection. So it's an at-home blood collection where it's a blood spot. So we're looking at inflammatory markers. So within our phase 2, our demographic results, we had 10 participants. So again, it was 2 groups of 5, average age of 53 years, average tenure of 26 years on the job. We had 100% were male, 50% were active, 50% were retired, and 50% were currently undergoing treatment. Since this was something that was done completely online, we were able to get survivors represented from Florida, California, Minnesota, and New York. And we had about 8 different cancers that were represented. And so then when we look at the feedback and how we can make changes, some of the positive things that came out of it was that it was a confidential setting to discuss the illness. It encouraged meditation, helped others by sharing own health experience, helped set goals, encouraged documenting daily routines, improved sleep, exercise, nutrition, mindfulness, among others, and it reaffirmed making the most out of our lives post-diagnosis. So overall, we saw that some of the most positive things that came out of it was, they enjoyed the videos, the information, it was a good flow and outline, and they liked having a participant workbook. So not only do they have the Zoom link and they have the portal that they have access to 24 hours, but we also send them a workbook that they can go through and answer questions, and all those activities that they see online are there in that workbook. Some of the negative feedback, some people were not fond of the meditation. We saw about 50-50. Some people liked it, some people didn't. Our stock photos were not all American firefighters, so it was a good thing that we needed to change some of those. So little, tweaks here and there. Some people had a little bit of the technical difficulties and portal glitches that we've been working on. And so this obviously looks like a very long slide, but I think it's really important to highlight some of this feedback that we've gotten from some of these survivors, because it really was just so, from our interventionists who ran it, they just said it was so rewarding. They've done this type of research for many, many years, over a decade, doing the same type of intervention, not with firefighters, but with other cancer survivors. And they just said they loved the firefighters so much, that they got so much out of it, and they were so receptive and so open in giving feedback. One person said, you listening to their perspective and experiences was very valuable, and offered some insight into different strategies when dealing with our common issues. It also allowed me to be a sounding board for each other and an assurance that we are not alone in this endeavor. This fellowship was a very special component. So we did see that was one of the biggest strong suits, was having this fellowship of cancer survivors that were firefighters, that they were able to work together. And so next steps is we are 1 month away from doing our 3-month post-assessments for our phase 2 intervention. We're currently modifying our workbook and our program based on the recommendations from our phase 2 participants. And then next up, in the next 2 months, we'll be recruiting and enrolling for the actual intervention. So we'll be doing 6 groups of 5, so a total of 30 firefighters that will then be going through the intervention at the same time. And so in summary, that's it, if anyone has any questions. Okay.
So we're going to have actually our next presenter present, joining us virtually online, and then we'll entertain questions from the audience. So our next presenter is Dr. Vandana Sookdeo. She's the Director of the Clinical Research Services and the Cancer Survivorship Program at Sylvester Comprehensive Cancer Center. So please help me in welcoming Dr. Sookdeo online to present.
Hi, good morning, everyone. Thank you for the introduction. And first of all, before I get started, I'd like to say a very big thank you to the group for having us present today. I'm Vandana Sookdeo, Dr. Sookdeo, the Director for Clinical Programs at Sylvester, and I'm presenting on behalf of Dr. Frank Pinedo. He's the Director for the Cancer Survivorship and Supportive Care, as well as the Associate Director for our Cancer Survivorship and Translational Behavioral Sciences Program at the University of Miami. Unfortunately, he couldn't make it today, but he very much looks forward to attending this event, and he's actually out of town, so I'll be taking over on his behalf. Next slide. So we'll start off with defining cancer survivor and cancer survivorship. So a cancer survivor is defined as someone impacted by cancer from the time of diagnosis through the balance of life. So during this cancer survivorship experience, it includes family members, caregivers, friends, and the community of those affected by cancer. Due to advances in the early detection and treatment, the estimated number of cancer survivors in the United States is expected to rise to 20.3 million in 2026. And this is a 30% increase from 2016. So therefore, the need to expand cancer survivorship care and support services has been recognized. In fact, the National Cancer Institute's Office of Cancer Survivorship lends to support the enhancement and quality and the length of survival of all persons diagnosed with cancer in order to prevent and minimize and manage the adverse effects of cancer and its treatment. Next slide. So why do we place this emphasis on cancer survivorship? Well, as I just mentioned, with the growing number of cancer survivors in the United States, it's been identified that the survival itself, that process, is offset by multiple challenges. And identified challenges include the side effects of short-term and long-term treatment, the physical and social limitations, as well as the pre-existing comorbidities or illnesses in the aging population. So in addition, there's always that financial burden and the complex care of cancer, which is a hurdle in itself. So as a consequence of these challenges, it was highlighted that the needs of cancer survivors were not being met. And these needs included the physical needs, emotional, social, financial, as I mentioned earlier, proper care delivery, and care coordination. Next slide. So a significant amount of time and effort was dedicated to identifying these specific patient-reported needs. The quote-unquote stressors included, but were not limited to, concerns about nutrition, family, financial, occupational concerns, religious, physical, and practical needs, such as transportation or childcare or advanced directives. Next slide. So at Sylvester, our cancer survivorship program includes clinicians and scientists who collaborate across all the disciplines to address the multiple components of cancer survivorship, with the goal of enhancing our patients' physical, emotional, and spiritual well-being. So in addition to fostering this specialized cancer survivorship care with focus on symptom management and customized care plans, we also implement evidence-based research and provide with the goal of providing coordinated services across the health systems. And our cancer survivorship program actually encompasses the entire realm of site diseases for our cancer patients. So from a physical discomfort to emotional stress, we understand how a cancer diagnosis and treatment can affect every aspect of a patient's life. Our cancer support services address the physical needs, emotional, social, spiritual needs before, during, and after treatment. So one of the ways we enhance the survivorship care experience is through My Wellness Check. So you'll notice that before your clinic visit, or before a patient's clinic visit, a questionnaire is sent via the patient portal. So the patient would use My U-Health chart to complete the questionnaire and inform their care team about all areas of well-being, including side effects, symptoms, or concerns like transportation, pain, physical function, or childcare. So depending on the patient's needs, we are also able to identify and provide specialized survivorship care through our specialty clinics. And in addition, a patient can also request a personalized cancer survivorship care plan, which we encourage because it's created just for the patient with the help from the medical team. So we encourage our patients to take advantage of these offerings and get to know them during their patient experience. Next slide. So for more information about the Cancer Survivorship Program, please feel free to visit our website, www.sylvester.org/cancer-survivorship, or you can contact us at sccsurvivorship@miami.edu. Thank you so much for your time today.
Okay, don't leave us just yet, Dr. Sookdeo. Are there any questions here in the room or online for either Dr. Schaefer-Sally or for Dr. Sookdeo that you'd like to ask about the cancer survivorship? I probably should get my phone. Okay, I'm not seeing any questions online and none in the room. All right, so thank you both very much for this presentation on cancer survivorship. Okay, so next steps. We are off to lunch. And, but before we do that, I have one quick presentation. I know, don't kill me. I know you guys are hungry and want to go to lunch. So you remember yesterday during the pre-workshops, we had our scientific session where many of the future research workforce was presenting on different topics of cancer in the fire service. And so we'd like to recognize through the top 3 poster presentations from yesterday's session. So when I call your name, if those scientific presenters would not mind coming up here to the stage and receiving a little something on behalf of the Florida firefighters and the Firefighter Cancer Initiative for all the research work that you've done. And I actually like to pause for a second and ask all of our scientific presenters, poster session, to please stand up and be acknowledged by our audience. So if you presented a poster yesterday during the workshop session. These are our firefighter cancer researchers and future generation researchers. So thank you very much, guys. Grab a seat. Okay, so we will start backwards. Okay, do we have slides for our presentations? Okay, so our third place award goes to Mark Gaskill, who's a graduate student at North Carolina State University, who presented on the evaluation of current fire investigative protective ensembles against infiltration of airborne particulate. Mark, please come join me here on the stage.
Okay. And our second place winner goes to Alexia Kaftusau from University of Miami.
And certainly, last but not least, our first place winner is Arash Kasebi, a PhD candidate from North Carolina State University who presented on particulate filtration efficiency of firefighter hoods after exposure to wash and wear and on-the-job exposures from the field. Congratulations, Arash. Okay. All right, thank you very much for indulging us. I think this is really important to recognize our future firefighter researchers. So we are going to go on lunch. Please be back here in the field room at 1:30 p.m. So please get up, stretch, DVT prophylaxis, grab some lunch, and we will resume our presentations at 1:30 p.m.